You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org.
In commemoration of National Health Center Week 2010, AAPCHO brings you this special edition of Voices from the Frontline, Innovations in Workforce Development. Voices from the Frontline is a podcast series dedicated to spotlighting the unique experiences and insights of the dedicated, passionate people at the helm of AAPCHO's member health organizations. In this episode, Communications Assistant Beverly Quintana interviews Dr. Daveena Ma of Asian Health Services about the REACH internship program, its immediate impact on the health center, and her hopes for its success in the greater community.
So we have Daveena here today to ask her a few questions about workforce development. Could you tell us briefly about Asian Health Services and their workforce development program?
Sure. Well, first who we are very briefly. We're an FQHC located in part of Oakland's Chinatown. We provide services in 9 Asian languages and English to 20,000 patients, and 98% of our patients live below 200% of federal poverty level. 88% of our patients are linguistically isolated. And so it's very clear that developing a large group, a sustainable group of linguistically and culturally competent physicians and other providers is critical to the existence of our organization.
What are the major components of the program?
Well, the part that I've been working on is the only formalized workforce development part. You know, AHS has been around for over 30 years, and it's always served as an ad hoc pipeline, both to our own community and to the greater Asian American community. But what we've started is a program called REACH, and that's the Real World Education and Advocacy in Community Health. That's a program designed for college students, juniors and seniors, and recent graduates who are interested in community health. And what we've developed is a program that gives a really broad exposure to the community health center. And what we're hoping is that if we can show these students, you know, we're getting these very gifted, talented students, we want to show them that this is where their talents can be best utilized. This is where they can make the greatest impact. And so we have them shadowing our providers. We try to pair them with providers who speak the same language as them. We have them working with our advocacy and development teams. They do a lot of fundraising work. Under their supervision, they do research for grant proposals. They go with them on rallies. They're involved in a lot of community organizing. We also have them work on individual projects, and these are projects that either they have proposed themselves or that have been proposed by individuals within our organization. And you know, this is our 4th year doing this program, and as the years have gone along, it's becoming so integral to our community that during the year, different people will start identifying specific needs, and these slowly evolve into projects for which we will specifically actually choose interns that we think suit the project.
That touches a little bit on my next question. How does this program benefit Asian Health Services, generally speaking, and from a business standpoint too?
Yeah, no, it's when we were first designing it, you know, I really thought, you know, we're making something that's going to benefit the interns. You know, it's something they'll be able to put on their resume. They'll get this great exposure that they'd never be able to get otherwise. You know, and we're not going to be able to see the benefits for ourselves until maybe 10, 15 years down the road when they finally get out of residency and hopefully come back. And what we're finding is that we're getting immediate returns. You know, obviously people that we're recruiting are highly skilled. They're young. They're much more web savvy than, you know, most of our employees. You know, they have video editing skills. They have graphic design skills. You know, they're good photographers. They're great writers. And so projects just start piling up starting in February. People are thinking, okay, this is something that we're going to save for when the interns get here in the summer. And they just get put to work. They crank out all these great projects for us. And on top of that, the deliverables that we're getting from their independent projects are fantastic. We're implementing that violence prevention program at Oakland High School. We're taking the results of the studies that they've done on Medi-Cal de-enrollment or failure of breastfeeding in the API population, and we're implementing these changes. So we're getting very, very immediate results. One of our big dreams is that we want to see some of our interns coming from our actual patient population, and we want to see, or children of our patients. We haven't gotten there quite yet, but we want this also to be an investment in our immediate community as well. We want our pediatric and teen population to be able to see us as role models and to be able to see healthcare as a potential viable professional field for them.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.appcho.org and tune in for our next podcast at www.aapcho.org.